Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. Today I'm going to talk about spinal injuries. Now, spinal injuries are something I'm often asked about and people worry a lot about them. However, there's only about 700 instances of new spinal injury every year. Saying that, that's a lot. That's, a couple a day. But the sort of long-term effects, they estimate that there are about 40,000 people suffering from the long-term effects following a spinal injury, and that can be paralysis, it can be brain damage, it can be all sorts of things that can affect it. In our family alone, we have my sister and my nephew were both paraplegics following a car accident and a trampolining accident, so two separate accidents. So I've seen firsthand just how awful it can be and how devastating it can be to life, both for the person affected and for those caring and helping for them around them. So the key thing is, when might you suspect somebody has a spinal injury, and what are your priorities in terms of first aid and supporting them? So the key advice is, if somebody's airway is in danger and you're worried that they are actually not breathing or that they are obstructing and they're not breathing properly, then that is your priority. Whether or not a spinal injury is involved or you suspect one's involved, that is always your priority. So the advice is to suspect a spinal injury if somebody has fallen from more than twice their height, if they've been pushed with force, if something heavy has fallen onto them, if they've been involved in a road traffic accident, either within a moving vehicle or been hit by anything at speed, particularly if it's over about 15 miles per hour, which isn't that fast. If they've been doing any form of combat or contact type sport, if they have a head injury, think spinal injury, if they complain of severe neck or back pain and are struggling to move their neck, if they feel weak or numb or paralysed or have any form of hand, foot or motor weakness, if they've lost control of their limbs or their bladder or their bowel, or if their neck or back is twisted. And if you see how the accident has happened, so the mechanism of injury, that's really helpful for the health professionals to know whether or not to worry about a spinal injury. If we are worrying about a spinal injury, we will always be cautious. It's always better to be cautious because the only way to know for certain is by having an X-ray. And in fact, somebody can walk into casualty with a broken neck. And that's a broken bone, but it's that spinal cord which you don't want to twist if it's more vulnerable because there's broken bones around it. So that's what you're trying to avoid, any additional pressure from a vertebra that's been damaged or enabling it to do that twist. It's that twisting movement that very often causes the damage. So we are always cautious, and the majority of the time, thankfully, a spinal injury is ruled out. Now, NICE have got additional guidance on spinal injury, and they say that anyone who has had a sort of mechanism injury that could have caused a spinal injury, if they are also under the influence of drugs or alcohol, if they're confused or uncooperative, if they're unconscious or have a reduced level of consciousness, you should also be treating them as though they might have a spinal injury. So always be cautious. They say to be cautious as well with children, and be cautious with anyone who has any spinal pain, hand or foot weakness, absent sensation to the hands or feet. But again, they can have spinal bony damage without that happening, because at that point the spinal cord itself is unstable but it's not damaged. And if they have a history of past spinal problems as well. The key things to follow if you suspect a spinal injury are if somebody is conscious, if it is safe to leave them where they are, then keep them as still as possible, keep them calm. If you're able to support them using your hands, it's quite difficult for me to do like this, supporting their head and neck, have your fingers open so they can hear you, and actually keep the head and spine as still as you possibly can if you're able to do that. Do not struggle with them, so if they don't want to be supported, then that's their decision. So if they're conscious, you're encouraging them to remain completely still and supporting them if possible, and you're trying to avoid them twisting. Keep any helmets on. The only time you would remove a helmet is if you're worried about their airway and their airway blocking and then beginning to obstruct, in which case there's usually some way of getting better access, but sometimes there isn't, and sometimes if the airway is in danger you will need to take the helmet off, and that with someone, if you suspect a spinal injury, is a two-person job. You would have one person supporting inside the helmet like that. You would loosen the strap and loosen that out a bit, and the other person would be rocking it off like that, twisting the neck as little as possible. If the person is unconscious and not breathing, you're going to do CPR. And if you've been trained to do a chin lift or a jaw thrust in order to avoid that tilt head chin lift, then that would be a good thing to do. If you haven't been trained to do that, then the Resuscitation Council still say tilt the head, lift the chin, and do the resuscitation as you have been taught. If they are unresponsive but they are still breathing, then you would ideally have some other people to help you, and you would log roll them very carefully into the recovery position. Now there's all sorts of additional advice and support and diagrams on that on our websites. So in terms of log rolling, ideally you would have other people to help you, or someone would be supporting the head and neck and other people would be rolling, and it's all coordinated. If there are two of you, then again one would be supporting and the other would be using the person's head, hands like this as well, and supporting. And if there's no one else and you're worried about their airway, you will need to do that on your own. Your priority is always the person's airway. Now I really hope that's helpful. That's Emma Hammett from First Aid for Life and onlinefirstaid.com, and there are loads more resources on our website, again with diagrams, which is particularly helpful with this topic. Thanks very much.